think it's hair?
Mm-hmm. And I think with the way that the light is catching it, yeah.
You don't think I'm dealing with something that's moving, is what you're saying?
Mm-mm. No, I don't see any sort.
Is there a reason that, like, yeah. I know you get crazy people in here, but, like, is there a reason that you don't believe patients when they tell you, and they, you know, I can show you, like, I'm not trying to show you a ton of pictures, because I know pictures aren't going to, like, get me any diagnosis today, but for reference, it's graphic. This was not the worst of.
Yeah, and I mean, that definitely looks like you had a pretty bad infection. Did you have some cream on there too? So just typically when someone has like a moving, living organism in the skin or in the scalp, we're usually able to see it at the time that you're here. And I'm not seeing anything, I'm not saying that you're not experiencing this, but I'm not seeing anything on the back of the scalp that looks like there's even been areas of entry where like they've burrowed or anything like that. I mean, I see some areas of scabbing. Oh, sorry, is that tender?
That's really
sorry. I'll stop. I'll stop touching.
Okay.
It is more that back area. It does look irritated and infected though. So I mean, even when you're feeling like something is crawling, is it?
Like I get my camera, I get my phone out.
Yeah.
So I was sitting and, you know, trying to stay warm and using my phone, and I can feel these mites. But I can't see them very well if I just go look in like the bathroom mirror because they're so small, you know. But I get my phone out and I get it real close, and I have to look for a while because the way I think of it is like a toddler's footstep compared to an adult. They move slower, so you got to watch longer. So like the mites they are more active different times, you know, but they were really active, and I felt very subconscious because people around me, and I don't want to give anybody anything. And of course you don't want, you know, I also have like these maggot things that are living in my nose, and when I try to pull this out, I can't get all of it. But y'all don't see that. Y'all don't see the maggots in my nose. Could you get a stethoscope and maybe check my nose? But like the mites, like I could feel them when they're more active. I don't know where they go exactly.
Yeah, I do think though.
So like I don't know if you have the right kind of thing. Like it would probably need to be not magnifying. You know, I don't know if you have like a light and a magnifying thing, and you could look on my face because you probably could find mites. And you know, I'm not making this up.
Yeah, I like I said, I totally believe that you are you know, seeing these things and that you are feeling them and experiencing them. I do not doubt that one bit. It's from our end difficult to make a diagnosis without seeing any sort of things that are moving.
How about the thing I passed in the toilet? That was today.
Yeah, and that again didn't look like an organism to me.
What would I'm just okay? I'm not trying to be argumentative. I'm just trying to gain clarity for myself. What would you guesstimate that could have been?
I'm not sure, to be frank.
Like some kind of food? Is that what you're thinking?
Could have been, yeah. I do think though. I mean, you definitely have some irritation, and it's very painful and inflamed on the scalp.
Radiating pain that's constant in my back.
Yeah,
and that went along with when I was having a lot of candida when I had my almost 18-year-old. And you don't believe me that I saw the worm actually go up in here. You don't believe that this could be worms lodging out and hanging out in there, comfy.
I don't think there would be. I think it's very unlikely that there's a worm that went up into your eye. And
I watched it myself.
And that we're not.
I was holding my phone at the time.
And that I think is still there.
What was I saying? Oh my God.
Asking about mental health diagnoses, like you walked from.
I'm like been really. Really trying to get help with this. I'm not making this up.
Yeah.
Like I'm the one dealing with like
permethrin is like, so I'm not seeing anything that looks like mites or scabies. They usually have a very distinctive pattern of the way that they crawl in the skin.
Will you check my nose like I asked and my face?
Yeah, Dr. Drew's gonna grab the I'm not seeing evidence today of an infestation of any sort.
Because these things weren't here 2 weeks ago. And this, like I said, I just found out about yesterday.
I truly didn't see anything concerning.
Slow.
Yeah, and he'll take a look, but I'm not seeing evidence today of an infestation of any sort.
Because these things weren't here 2 weeks. I'm showing you pictures, and
so like here's I guess one point. What if that was like what was going on with you?
Like, did you not see any maggot on the picture, like with the vagina? Did you not at the bottom?
No, it didn't look like maggots to me.
The stuff in the stuff closer up didn't. Because I believe is they kind of got dissolved because I had done such an aggressive treatment. So this is the day after that. You know, it was kind of more like residual stuff of maybe bad guys I pulled out.
Yeah.
But like there was one, I believe, down. I don't know where it came out of, you know, because I can't see everything when I'm. You know.
Yeah.
But
sure.
I believe in that picture there's a whole one at the bottom, a whole maggot at the bottom. But I mean, I know when I saw them, you know. So you don't think any of them look like it. I understand that the stuff at the top didn't.
Yeah.
But you don't think even the one at the bottom looked like one.
Mm-hmm. And like that, like so exactly like you're describing, right? Like to us, we're not seeing it. You are seeing it, you know. And so like that's the challenge. Like you're saying, I'm seeing different doctors. Each one is telling me that they're not seeing what I'm seeing, right? And so like you get frustrated because you feel like we're not treating what you see yourself having and what you're feeling yourself having, right? And so like that can be frustrating.
But I've also taken pictures. I haven't shown y'all. No. But I'm just saying, like, I've taken video and pictures as documentation for myself and for anyone, like a doctor, whoever I want, you know. And so, like, I'm not just saying it. If I'm saying it and it happened the day before, I'm showing you the picture, referencing what I'm speaking about, so that it's not. I'm hoping so you can see that it's not just a figment of my imagination.
100%.
But
exactly.
y'all still aren't know. Even
Yeah,
doctors yesterday, I
the
showed them
videos.
like 20 pictures, or
Exactly.
the other hospital showed them 30 pictures,
Yeah.
and they still. You would think I'd show them black blank.
Exactly.
Nothing. And I don't
100%.
understand that.
Exactly. That's what's tough, right?
Well, why would they not see?
Why do we not see? None of us see it. That's the problem, right?
I don't know. Yes, that is the problem. I don't understand that.
That's what I'm trying to say.
Are you making a joke?
No, it's not a joke.
Okay.
It's not a joke. I'm just saying, like, let's say you were the doctor. If you had a patient and they were the only one who saw what was happening to them, despite video and photo evidence to everyone else, what would you think?
They do have some hair. These are these maggots that are like, I would describe their color more like clear, and they were this big before. This is the day I shaved my head. I went to a truck stop and paid for a shower, and I had the medicine, and I was determined to like get this under control, and that ended up being these huge things, and all but one came out, and there was one like around here that didn't come out until it was a few days later, and I got in a hotel to take a shower, and it came out and it landed in the sink, and I took a picture, and I have a video of it somewhere, but it would take me time to find the right video and then show you. But what it looked like, the shape of it was like layered, almost like feathers would be, and then each, if you want to say feather, was kind of like the way a feather would be, or a wing of an insect. You know, it had like markings this way, so it was kind of like layered, and then so
That's okay. No worries.
like this was the drain, and these were smaller ones. You know, and yes, there is some of my hair.
Yeah, which makes
But
it,
do you see how that has like a hook shape there? Like that's a worm. But this part here is my hair kind of stuck to it. But that doesn't look like a worm to you.
Exactly. Yeah.
It doesn't?
Mm-hmm.
Okay. So what would you think it would be?
I just see kind of like hair and other debris kind of going down the drain. That's what I see in that picture.
Have you heard of like certain worms like having like kind of a hook?
Yeah, we know. We like learn about them.
I know. I'm sure you do. I'm not trying to. I'm not trying to.
No,
I just
it's
want.
okay. Yeah.
Okay.
Regardless,
Okay.
like Dr. Kissel Smith said, we'll definitely like try and give you those treatments to like help the irritation on the scalp, if you are open to it. The reason I would suggest a referral, please don't take offense to this, but I recommend a referral to a psychiatrist. I think that would be something that we would recommend to you anyway. And it's because we think it would help you. Mm-hmm. That's why. I think with time, like a lot of these skin changes can get a lot worse, and those can be dangerous to you. Okay? And psychiatrists can sometimes help with it.
Okay, now hold on, that's confusing. I'm just trying to understand, how can psychiatrists help with my skin conditions?
So they can help with let's say
like the scaliness here and stuff?
so like some of the are like and what initially like caused the scaliness and that kind of thing.
What do you mean by that?
So like I had a patient one time, for example, who ended up burrowing a hole through her eye, like all the way down. It's because she was trying to get a parasite that was in her eye. She kept going at it, she couldn't find it, and she kept going, and eventually she needed like a super specialized surgery just to repair her eye. Okay.
So you think I'm self-harming because I think there's something there?
So sometimes people end up trying to treat themselves, right? Mm-hmm. They're trying to get at the parasites in their eye or somewhere else or in their head, or they're scratching and they're trying to find it, and they end up causing damage to the skin.
So that would be that delusional.
Infection.
That would be that delusional term then, right? And so that's what you think. That is what you think as well then about me.
It's
you be honest, because you're real nice. I don't hate you.
Okay, I appreciate that.
But that's what you think, like your professional opinion.
Correct.
Okay.
Yeah, and it's just like again, like obviously for you, it's not like because you're seeing it, right? You're experiencing it, you're feeling it. For the other like healthcare providers so far that you've seen, different doctors, different hospitals.
But the two first ones did not ever give me a physical exam. They only said that.
Yes.
So I don't feel that's very fair.
That's not fair.
Because
they should have done their due diligence.
Guess what happened on the second one that refused me to actually examine it? Guess what? I didn't know I had 4 maggots in my navel at the time. Like if someone had done a full body, then we would have. But okay.
Got it. Exactly.
But of course, when I found them, do you think I'm going to leave them there until I can go to the doctors again? Like, you know what I'm saying? It's pretty horrific to find.
Exactly. So,
but I understand you don't believe me that I even found them, so it's like, oh my god.
Right? It's a tough paradox, right? So, but here, if I were you, why not, like, you know, give and take, you know? We'll give you some treatments for, like, your scalp filtration, all that stuff. Why not just, like, go for a visit if we make that referral for you?
Because I know.
Because what if it helps and then you're cured?
Because
that's what I'm saying.
Because I know.
And I do have to go because I have to go.
Okay, but because the reason to answer that is because I actually know what's happening, and I have been recording it. You're not getting it.
But you see how we end up in the cycle?
No, because I think a picture does speak.
It does, but if it speaks to you, it doesn't speak to us. That's the thing. That's a bit challenging, right? Yeah. Like, not just me, right? If it's just me, you could say that's just one guy, right? It's Dr. Kissel-Smith, and it's like other physicians that you've seen, exactly. So that's the thing that, like, we just want to offer for you to consider.
And
we can't force you to do anything. You do whatever you want. Exactly.
I know that. Can you just say? Can you just say the term? It's like a 3-year. Can you just say the delusional? Can you say the term for me?
Yeah, delusional parasitosis.
Oh, so it's just 2 words.
Just 2 words. Yeah. Exactly. Okay. Anyway, let me get to the other patients and we'll come back. All right. Okay. Anyway.
Thank you.
For sure.
Appreciate it.
Yeah.
I'm very happy that there's a shelter available for cold weather here in Richmond, because I guess it's just a much bigger city. I'm so glad. But I'm not happy that these doctors think that I need to see a psychiatrist and that they think I've self-harmed. They think this is from me taking something to treat something that wasn't there and therefore causing myself harm. That's very degrading and discouraging, because I have pictures I've shown. I think it's pretty evident that there are things like, even like on my face right now, this sagging, it's like there's something in there and it's linear, because this has never been normal. And I haven't been like crying severely, but even when I like lost a son or something and cried a lot, like, this is crazy. And then if you saw my picture 2 weeks ago, like it's like, I'm not doing anything to my eyes and to my cheek. I am doing something to my head, but to treat something that's really been there. But yeah, and they don't think this could be the worm that I actually saw go in there, but of course they think I don't realize that I am delusional and I don't realize it. So that's the way it becomes a secular problem. So I came again today, and it wasn't worth coming again. Oh, I can't say that because I found out about a shelter. So I don't regret coming, because I found out we actually do have cold weather protection for the homeless people in this area. So I'm definitely staying in this area until I'm not homeless anymore, or an area with equal resources, because I'm not going to go back to these little rural towns where they don't help you, because frostbite and stuff is super scary.